Do doctors have the responsibility to reject a DNACPR request if they think it aligns with the patient's best interest? A DNACPR form is a medical order that is often agreed upon by the patient and their families regarding the rejection of receiving cardiopulmonary resuscitations post-observance of a heartbeat stopping. Mr. Garcia is a 25-year-old man who has been admitted due to a cardiac arrest, and the system shows he has a history of self-harm. Additionally, Mr. Garcia was recently in an accident. He sustained injuries to his ribcage and several fractures resulting in pneumothorax, meaning performing CPR on him would likely result in irreparable damage to his ribs. Mr. Garcia requests a DNA CPR, but in the case where the patient's family is unable to arrive, does the doctor have the responsibility of making a judgment to reject this request and perform CPR in the light of a potential long and fruitful life ahead of the patient?
Patients have autonomy. It is inappropriate for a doctor to deny a patient's request for a DNA CPR order. The doctor's role is to inform and advise the patient, not to make decisions on behalf of the patient without their consent. Denying a patient's request for a DNA CPR is equivalent to denying a doctor the right to practice medicine or a baby the right to drink its mother's milk, all in the name of the patient's best interest. Additionally, the GMC guidelines state that the principle of prolonging life should generally be followed, but it's not always required if it has negative consequences for the patient or if the patient's wishes can be known or determined. The doctor knows the patient's wish to have a DNA CPR written, but rejecting it is not only irresponsible, but it goes against patient autonomy and thus GMC guidelines, since prolonging the patient's life is done against their will.
Agreed. Patient autonomy is a vital medical pillar that medical professionals are expected to always respect. But this autonomy only comes into action if mental capacity can be established. A patient with a history of suicidal attempts or self-harm displays inability to make judgment themselves, and thus the medical pillars of beneficence and non-maleficence must be considered. 1 in 10 survive from CPR, and a doctor's decision, if considering the best interests of a patient, could lead to no further harm, but rather joy for the patient and their family in the future.
Even so, non-maleficence does mean to do no further harm to the patient, so rejecting their request for DNA CPR is 1, irresponsible, and 2, does mental and physical harm to them. So an unwarranted attempt to preserve the sanctity of life could actually lead to a significantly lower quality of life. That includes the inability to ever communicate, walk, or live life the same way again. So taking into account Mr. Garcia, even though the cost of a broken rib could lead to a fruitful life at some point in the future, it is more likely to lead to a further life of mental difficulties.
Establishing the premise that non-maleficence is not meant to contradict the medical pillar of beneficence leads us to conclude that a doctor holds the ability to judge if an action within medicine would yield a proportionally beneficial consequence, with the consideration of all the risk factors. The subjective nature of non-maleficence in this scenario makes the case difficult to discern. However, beneficence is what is to be generally followed as outlined in the GMC guidelines, especially considering CPR would have minimal reprimand in means of justice and equality in providing healthcare.
Autonomy, beneficence, non-maleficence and justice leads us to consider if the doctor in any scenario holds a responsibility in rejecting a DNA CPR request. In the case where a patient has full mental capacity, then it can almost certainly be said that autonomy must be respected. But in the circumstances where this isn't the case, and the secondary aspect of family is for whatever means unavailable, it is essential for doctors to critically analyse the state of a patient, taking into consideration factors such as, but not exhaustive to, age, religion, family support, risk of treatment and potential quality of life, before choosing to accept a DNA CPR request or not.